A very good evening and a very warm welcome to everyone present here with us today. This is Batul from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, who is present here with us today. Well, he is none other than the very renowned Dr. Vicky Jain, sir. Sir is MS in General Surgery, MCH Plastic and Reconstructive Surgery, consultant at the Aesthetic Clinic Mumbai, visiting consultant, plastic surgeon at St. Elizabeth Hospital, Messina Hospital, Apollo Spectra Hospital, and Vocard Hospital. With such wonderful experience and with his enriching knowledge, we are going to talk about the topic for today, which is gynecomastia. Before moving on to today's session, let us have a brief look on what the topic says. Well, to embark on a journey to demystify gynecomastia in our exclusive webinar dedicated to shedding light on the causes, treatments, and lifestyle considerations associated with this condition. Whether we are someone personally affected or a healthcare professional seeking comprehensive insight, this webinar is going to be a gateway for understanding gynecomastia from various perspectives. So, now without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him for his precious talk to begin. So, over to you.
Hello, friends. I'm Dr. Vicky Jain, plastic and cosmetic surgeon, as mentioned by ma'am. And I practice in the wonderful city of Mumbai. And today I'll be talking about a very common condition. Mind my words, is a condition, not a disease, gynecomastia, also called as man boobs and moobs. So it's a very 20% males have it. And so, as I told you, I'm based in city of Mumbai, consultant plastic surgeon in Bokard, Elizabeth, Messina, and Surana City Hospital. I have my own consulting chamber, the aesthetic clinic at Opera House. And as I told you, gynecomastia, also known as gynecomasia, moobs, man boobs. So this is just a basic enlargement of male breast. The classical feature of gynecomastia is male breast enlargement with soft, compressible, mobile subcutaneous tissue placed palpated under the areola of the nipple in contrast to softer fatty tissue. This enlargement may occur in one side or both. Commonly, it's on both sides. 1 in 10% might have unilateral. There is no breast symmetry. We have to remember, no both eyes are also symmetrical. So basically, we have to be okay that your breasts are asymmetrical. And I would say the people who say gynecomastia is only gland, no person, I would say no person has only gland and no fat, or only fat and no gland. There is a mixture of both happening together. So, as I told you, it's a condition, not a disease. Just like obesity is a condition, not a disease. Hair loss is a condition, not a disease. So, these don't cause any problems unless until they are controlled. So, what causes gynecomastia? Gynecomastia is caused by triggered in the decreased amount of hormone testosterone compared to estrogen. The cause of the decrease can be conditions that block the effect of or reduce testosterone, or a condition that increase your estrogen level. Gynecomastia can be caused by drugs, steroids, marijuana, as well as by other factors. They should be discontinued prior to surgery to minimize recurrence. So, any medicine or anything which is causing gynecomastia, which we suspect as a doctor, we have to tell the patient to stop it. If the if the size is going down, then yes, we should be happy and there's no treatment required. But if in case it's not going down, the only treatment for gynecomastia is surgery. So physiological gynecomastia is something which is very normal because of hormone imbalance happening in newborns, because of the hormones transmitted from mothers to the child, adolescents because of the hormonal surge, and older men because of the hormone going down. It is self-limited but can be treated to minimize emotional distress and physical discomfort. Non-physiological gynecomastia can be because of chronic conditions, cirrhosis, hypogonadism, renal insufficiencies, as well as medicines, supplements, illicit drugs, and rarely tumors. As I told you, discontinuing use of contributing medication can treat underlying disease are the mainstay of treatment. Medications such as estrogen receptor modulators and surgery have a role in treating gynecomastia in selected patients. Treatment should be pursued early and should be directed by the patient. Directed by the patient means the patient himself tells, I need the surgery. He should be desperate enough to get the surgery done because it is an non-emergency avoidable surgery. I again repeat, it's a non-emergency avoidable surgery. There is no harm if you don't get it operated. You get operated after 1 year, 2 year, 5 year, or you die at the age of 100 years with that. That shouldn't be a problem. And the most common cause is idiopathic. As I told you, 20% males have it. Every fifth male having moving on the road or you see around might have a gynecomastia. How to diagnose? Then it's more of a thorough history and physical examination obtained by a physician. But the patient himself comes and says, I don't feel nice in this body, I don't feel this nice, and I need to do something about it. So there are some patients who have shorter penile size, development, hypogonadism. So they might be very rare. Males with gynecomastia appear anxious, stressed due to concerns about the possibility of having breast cancer. But mostly they are anxious about their looks. Removing a t-shirt is a problem. Wearing a t-shirt is a problem. Going to swimming, going to bath in public places is a problem. Patients feel that other people are noticing. It's more of a psychological disturbance, not a disorder, not a disease. It's a psychological disturbance. There are grades of gynecomastia. Grade 1 is small enlargement. There's no skin excess, only puffy nipple, if I would say. Grade 2 is moderate enlargement with no excess skin. Grade 2B is moderate enlargement with extra skin. And grade 3 is marked enlargement extra skin. So to make it more simpler, 1 becomes 1, 2A becomes 2, 2B becomes 3, and 3 becomes 4. So we keep it 1, 2, 3, 4. So patients understand that way. 2 and 2B sometimes cause confusion. Patient feels it's grade 2 only, but no. Grade 2B is greater than grade 2A. That's why we have to be telling them clear. This is what I am telling you. This is first one is the grade 1, grade 2, grade 3, and 4. Can gynecomastia treated with diet and exercise? Firstly, diet and exercise are strongly recommended. They are always good for your general health, but neither will do much for your gynecomastia. Exercise, many times men with gynecomastia work out to build their chest muscles only to be disappointed in their contour. Actually, the excess gynecomastia tissue, which is there, gets pushed ahead because when you pump up your muscles, the muscles becomes more prominent and they push the gynecomastia ahead. There is no risk of cancer. The risk of cancer is similar to the men who do not have gynecomastia. So this makes the surgery totally non-emergency and avoidable. Then why the surgery is required? Indication for surgery. The most important question you should ask yourself is, does the condition bother you, both physiologically and psychologically and physically? Should the answer be yes, positive, you should consider surgery or start to gather information that will help you to make an intelligent decision whom to consult. I would say the plastic surgeons do it very regularly. If I tell you in last 3 years, I must have done 600 to 700 gynecomastia surgery. Treatment can help men reshape the male chest and dramatically improve the shape and proportion of your body, enhancing the appearance and very important self-esteem. The confidence comes back. They feel very nice. The confidence is supreme after the surgery. I would say very much supreme after the surgery. Men suffering with these conditions are very much worked about their looks and constantly bothered. They feel embarrassed to go to social gathering because of fear of their looks. Wearing a t-shirt is a very difficult option. Best treatment liposuction with gland removal. Why liposuction? As I told you before, no men have only fat and or only gland. Both are at together. So liposuction removes the excess fat and gland removal makes sure that the excess gland is removed. What are the pre-operative requirements? A CBC or a complete blood count is required for all surgical patients. For all other patients, a PT, PTNR must be possibly requested if you have been using any type of aspirin containing medication or certain type of vitamins or supplements. A pre-operative triple H, HIV, HBCG, HCV is required for all operation theaters. For anesthesia fitness, X-ray, chest, and serum creatinine is required. Sometimes a local ultrasound is required to confirm the pathology. What a surgical scar looks like. Every effort is made to minimize the scar for surgery. Usually a 4 to 5 mm, that is 1/6 of an inch, or maybe half a centimeter, incision made on the side of the chest, just down the armpit. It resembles a small blemish rather than a scar. If an incision is made around the bottom of the areola, it tends to heal extremely well, and although permanent, it is virtually undetectable in most of the patients. Someone who wants to see the scar will be able to see the scar, but I would say the scars are not ideally visible. And after the surgery, once the scar is healed, I give scar management to make sure things go nicely. It's a daycare surgery. Patient can go home on the same day after surgery itself if the surgery is done in routine hours. Routine hours may be 4 o'clock. can resume normal life and duties in couple of days. After surgery, a pressure garment is required for 24/7 for 4 weeks at least, and then daytimes 2 weeks at least. The patient can start heavy exercises after 4 weeks of surgery. Complications are there. No surgery is without complication. There is chances of infection, hematoma, seroma. So any breast surgery is associated with hematoma or seroma. And very important thing is unsatisfactory results. Satisfaction is somewhere in the mind. If you think it is good, it is good. If you think it is bad, it is bad. Most of the patients are satisfied. Gynecomastia surgery is one of the best surgeries where the unsatisfactory results are very very less. Some results, this is grade 1 operated, and you can see the side cut somewhere. If you can see it somewhere here, and the scars after surgery, they look barely visible. And these are grade 2, and this is grade 3 after surgery, and these are very early results maybe 2 or 3 days after, and this is how it looks like. And this is grade 4, yeah. So these are very healed results. Can you see this result? So people are happy, I would say. Simple as it seems, the perioral scar is also not seen. Okay, this was my first case of gynecomastia in my private practice. Very difficult to achieve, but I achieved a good enough result. This is a very early result. In this, I didn't do the gland removal because initially we were taught not to remove the gland, but this was something 8 to 10 years, 8 years back. Right now, I remove gland in each and every patient. This is a unilateral gynecomastia operated. The scar is barely visible, as you see. The patients are very happy, and this is a healed result, very old healed results. So there is a asymmetry always, as I told you, but they're okay. So since it's a cosmetic surgery, so it's best done by a plastic surgeon. I would say it's always better to be safe than sorry, rather than getting it done by someone else and then have a recurrence, because I am known to treat recurrence of a lot of gynecomastic surgeries. That's why. And thank you, and queries are welcome. I've been so good at it right now, gynecomastia. I'm just like the guy in what do you say? Which movie was it? I forgot. So he used to just ratify everything and say, similar is me, I am Miri, I can do gynecomastia. This dialogue he speaks, similarly I can do this way. So you can search on YouTube Dr. Vicky Jain for my YouTube channel. My YouTube channel videos, a lot of them on gynecomastia, which will help you understand gynecomastia. So three surgeries which I love from the bottom of my heart is: one is gynecomastia, second is diabetic foot and lipoma. That's why when they approached me, I came along with that first surgery, which first lecture which we should do is gynecomastia. Thank you. Questions are welcome. This will help us. Okay. Yeah, Batul, we can take the lectures.
Yes, sir. Thank you so much for uh, giving us such an enriching talk about the topic shared today. We have received few questions from the participants. With all your due permission, I would like to put across those questions to you. The first question is: how does gynecomastia impact patients' psychosocial well-being, and what role does preoperative counseling play?
So basically, psychosocial is a very important reason why people get operated and get bothered. Ideally, it doesn't give any physical problems. Psychosocial, they get into the circle where they feel less confident. They try to put their shoulders inside like this, somewhere like ahead, to hide the gynecomastia, and they avoid social gatherings. As I say, marriages are avoided, going out, going to the pools are avoided. The confidence goes very low. So they sometimes feel very guilty why they have this. So I would say that's why people, under 90% of the people, get it operated. It's not a more of cosmetic surgery, because cosmetic surgery is some is done something where there's no problem and they're getting done. This more of a reconstructive surgery or plastic surgery where there is enlarged male breast and they want to get rid of it. Yeah.
Thank you so much, sir. Thank you for answering that question for our viewer. We'll move to the next question that we have received. And the question is, how do you manage patients' expectation and address potential complications during the follow-up period?
So after surgery, I tell all my patients that you need to follow up with me. And follow up means I seal the surgery site with a pressure garment. I tell them pressure garment has to be removed by me only, because the most highest possible chances of hematoma are in first 2 to 3 days. Hematoma, that is bleeding, because there is a dead space. So I tell them the pressure garment has to be removed by me, because then I can take the responsibility of any hematoma happening. If some patient removes the pressure garment and then is moving around, I cannot take the responsibility of that. And any complication, I would say, in gynecomastia is manageable. Surely not life threatening. There is a hematoma. Recently, I had one patient who had hematoma, but he was known hypertensive. So I explained him, and we couple of times we removed evacuated hematoma in my clinic itself, and he's doing fine. I'm genuinely happy, and that's where we have to explain the patient that the complication is very common. That is 5 to 10%. But managing the complication safely is very important.
Thank you so much, sir. Thank you for answering that question. We will take the next question that we have received, and the question is related to the recent advancements or ongoing research studies related to the diagnosis and management of gynecomastia. So, are there any recent advancements or ongoing research, sir, about this topic?
So basically, with us advancing world, there are a lot of what are a lot of this thing, what is it, research is going on. There are a lot of machines coming up. So I would say there is something called as laser machines for liposuction. But I would say in gynecomastia, we don't require such machines, because there is no excess skin. There's no excess skin. And so as per se, gynecomastia doesn't have anything coming up. But people who want to lure patients, they use those machines and tell them patients, okay, I'm using laser. But I don't see any difference between laser and normal liposuction, which I do commonly.
Thank you so much, sir. Thank you for answering that question. And we'll take the last question from our viewer. And the question is, what strategies do you employ to ensure effective communication and support for patients dealing with gynecomastia?
So first of all, whenever patient contacts me, I tell them to first see my videos. So they are more soothing. Where I have told this is not a disease, this is a condition. There's nothing to be worried of. I tell them, I explain them everything. Everything means everything. And first question when they come to me, I ask them what bothers you. Most of the patient tells me nothing bothers them, but I tell them the very fact that you have come to my clinic, or you have asked me what I can do for you, is something is bothering you. And that's where they come, open up. I tell them, yes, this is a story of every guy who's coming to gynecomastia for me, and that's how it ends. Com- and that's why we become friends. I explain them everything. I make sure that the patient's event is taken care of, the surgical event.
Thank you so much, sir. Thank you for answering all the questions from our viewers that we have received today on this forum. And I would like to thank you, sir, for taking out your valuable time and for being here and sharing such an enriching talk with us today on this platform. So, thank you so much, sir. With all your last comment and with a take home message of yours, we can conclude the session here for today.
So I'm very thankful for IGCP giving me this opportunity to present my work and helping me to grow. And thanks a lot. What else? We look forward to work together to get more good updates for the patient, for the doctors to grow, and our fraternity to learn more things, better things.
Thank you so much, sir. Thank you. With this, we are concluding the session here for today. Thank you, sir. Thank you
Okay.
to all
Have
our
a good day.
viewers.
Take care. Bye bye.
Bye, sir. You
Bye
too
bye.
take care.